I would like to introduce myself. I am Dr. Lazar Lazovic, interventional neuroradiologist from Serbia, and I'm working at medical imaging department at Ibn Sina Hospital. I'm going to share with you one interesting case of neurovascular complication in COVID-19 disease in children. So it is already well known that COVID-19 disease carries high rate of mortality and morbidity. There is no doubt that respiratory and gastrointestinal systems are the most affected. However, as time is passing by, we are reading more and more reports about cardiovascular system involvement, and through this involvement we can see different neurovascular complications, mainly in severe COVID diseased patients, and these are ischemic and hemorrhagic strokes. I'm presenting a case of 13-year-old female, so a child, that was admitted to a hospital because of severe headache and short loss of consciousness. At admission, she had right side weakness. Glasgow Coma scale was 12, and she hasn't had fever or any other COVID-19 symptoms and signs. CT of the brain was done, and we can see that there is a large frontoparietal left hematoma. There is a hemorrhage within the ventricular system, and there is a midline shift to contralateral side of 5 millimeters. Nasopharyngeal swab was taken, and the patient was shifted to Ibn Sina Hospital for further treatment. At admission to Ibn Sina Hospital, GCS dropped from 12 to 8, so there is a worsening of the clinical state of the patient, and she was brought to angio room immediately. So I have done the digital subtractional angiography of cerebral blood vessels, and after the injection of contrast media in left internal carotid artery, I found that there is an aneurysm at left MCA. On the lateral projection, we can see that aneurysm is not arising from the branching point of the MCA where the aneurysms are usually located. Actually, it is distally on M2 segment of one of the branches of the MCA. On 3D reconstructions, we can see that actually the aneurysm doesn't have normal morphology for the aneurysms. It is irregular. There is tapering of parent vessel proximally and distally from the aneurysm, with slight dilatation of the blood parent vessel further distally. These are all signs of dissecting pseudo aneurysms, and in discussion with neurosurgeon, because of the large hematoma and easy accessibility of the aneurysm for them, we decide to shift this patient immediately to operation theater. 24 hours later, after the surgery, follow-up CT with CTA was done, and on CT scan we can see that EVD is placed in right lateral ventricle. The hematoma is almost completely evacuated. There is small blood remnants here and here. There is right frontal pneumocephalus, and on CTA and diffuse brain edema. On CTA we can see that surgeons has clipped the aneurysm proximally and distally. This procedure is called trapping of the aneurysm, and they exclude the aneurysm completely from the circulation by sacrificing the vessel. On sagittal views, you can see that there is retrograde filling of the vessel that is clipped from the collaterals. And this patient, however, in this moment, we received the information that PCR test for this patient came positive. So patient is shifted back to COVID hospital for further intensive care, for further intensive care. Chest radiograph done before the invasive diagnostics and surgery, so as a measure of preparation of the patient for further treatment, show that there is no signs of respiratory disease. 10 days later, another follow-up CT was done, so we can see that there is an improvement of the brain, so we don't see edema as big as it was immediately after the surgery. EVD was taken out, and there is a small blood remnant within the occipital horn of left lateral ventricle. However, there is no hydrocephalus, there is no midline shift, and hypodensity or at the region of hemorrhagic stroke is a little bit less. However, on the other hand, we have progression of the respiratory disease, so lung consolidation and pleural effusion as well. This child developed more complication of COVID disease, and unfortunately she died 1.5 months after the surgery. So if we take a step back and go to statistics, we will see that aneurysms in children are extremely rare and consist less than 1% of total volume of all aneurysms that we are seeing. Incidence of subarachnoidal hemorrhage in children is also less frequent than in adults, mostly because these aneurysms are presented by mass effect, and we diagnose them and treat them early. So dissecting aneurysms, in etiology of dissecting aneurysms in children, there is trauma at the first place, connective tissue disorder, or infection. So by taking the medical history from the parents, we exclude the trauma as a possible case of formation of this pseudoaneurysm. She hasn't had any connective tissue disorder, and there is only infection as a possibility of formation of this pseudoaneurysm. What can be the link between COVID-19 infection and pseudoaneurysm formation? We have recently published paper with that nicely summarize the cerebrovascular complications in patients with COVID-19 disease. So we know that actually virus is using ACA2 receptors for cell entry. These receptors are expressed in arterial endothelium, so we strongly believe that virus can directly damage the arterial wall, and it can lead to pseudoaneurysm formation or rupture of already existing aneurysm. On the other hand, we have inflammatory cytokines that can also cause the condition named cytokine storm, which can cause the damage of the arterial wall. So the team of the doctors, including myself, find this case very important because it is the case that can be the link between COVID-19 infection and pseudoaneurysm formation in children, and we decided to publish this case. So the case report was welcomed by Acta Neurochirurgica, and it is published on 20th of July this year. Conclusion, I would like to say that full impact of COVID-19 infection of the neurovascular system is still not completely unclear. The exact pathophysiological mechanisms of the formation of cerebral aneurysms or pseudoaneurysms remain controversial, and we need more epidemiological and clinical study to demonstrate that pseudoaneurysm can be the early sign of COVID-19 infection. Thank you very much for your attention.